The Netcare Group has confirmed the temporary closure of its Kingsway Hospital in Amanzimtoti for new admissions after a patient there tested positive for COVID-19. Unions in the province are worried about the growing number of private hospitals in the province with staff that are testing positive. The hospital, in a statement, says that they're tracing the origins of the exposure to a patient who was admitted through their emergency department.
Yet another hospital in KwaZulu-Natal, this time is Kingsway Hospital in Amanzimtoti. Another patient has been confirmed to have COVID-19, and now the hospital has closed doors to new admissions. Next to me are unions who are very concerned about this COVID-19 issue in this hospital. Thank you very much, sir, for your time. Can you briefly give us your name and tell us what is your concern in relation to Kingsway?
My name is Mandla Shabango. I'm the Provincial Secretary of DINOSA. And we have members in this hospital who are very worried about what is happening because the confirmation of cases that are positive here, it raised a lot of challenges with them because some of them have interacted with those patients, and the testing system here, it is not the one that one will expect to be happening where all workers should be tested once the patient is confirmed positive. But what has been happening here, we think our members have been allowed to continue working without any precautionary measures, including the testing. But we've learned now after engaging with management that they have since closed the new admissions. Now they are dealing with patients who are already here, but they are not confirming to us in as far as workers affected, how many have been tested, what is their status, but they've confirmed that they are testing the workers, and we want to see that being done to all workers that are inside there, because our view is that this virus does not only focus on health workers in nurses and doctors, but it affects everyone who's interacting with that platform where patient was, or the nurses who have interacted with the patient. So we want the testing here to continue to all health workers that are here, including the cleaners.
As DINOSA, are you happy with the way these private hospitals are handling this issue of COVID-19? Because we did see that in St. Augustine, about 48 staff members were also infected with COVID-19.
As DINOSA, obviously, we are not happy because it cannot be that the private sector institutions are the ones that are now leading in failing to protect the workers in preventing this virus, because the expectation that is out there is saying workers who are in public sector are the ones who are more prone because of the facilities and resources they're having. But it is now coming in a very strange way that most affected healthcare workers are now coming from private sector, which means something is not done properly in these hospitals in following all the guidelines that are prescribed over this thing.
Thank you very much for your time.
Thank you, sir.
Let's just rope in the member of Nehau who will also tell us about their concerns as in Nehau. Baba, thank you very much. Can you have your names for record?
Ayanda Zulu, Nehau Provincial Secretary.
And briefly about the issue, COVID-19 in Kingsway.
Yeah, as Nehau, we are extremely concerned. To us, this issue of Kingsway is almost the same as the issue of St. Augustine's. We are more disappointed after having a brief meeting with management. It's the same attitude, the I don't care attitude, is the same attitude of arrogance, is the same attitude of being more interested on the maximization of profit and the PR exercise more than the lives of the workers. We are convinced as Nehau to say we think that the hospitals, both Kingsway and St. Augustine's, have not leveled the ground to be fatal for workers in terms of the provisions of the PPE, and also training workers about how to use PPEs and how to treat the patients with COVID-19. But our biggest concern is the failure of the Department of Health to exert its authority over both St. Augustine's as well as Kingsway. We last week wrote a letter to the Department of Health making a demand on the report on how the incidents of St. Augustine have unfolded. Up until now, there have been no response. That's an indication that the department is not interested in working with us as unions. Is only interested on the report that they are receiving from Netcare. You saw the statement from the CEO, Group CEO of Netcare last week. It's all is well statement, if you have to summarize that particular statement. It's the same statement that Kingsway have released this morning, is all is well, the situation is under control. I think the department is only interested in those particular reports.
So what's the way forward now?
On our level, as NEHAU, working together with COSATU unions that are here, we'll meet basically and have a strategy. But I think the first point of entry will be for us to speak to the Department of Health, to say, Department of Health, as a bigger demand now, can you reign over these Netcare hospitals? We still have got Mutlanga Hospital, another one in Margate, another one in Richards Bay. There's quite a number of Netcare hospitals, and we are worried that if the attitude of Netcare is like this is going to have a bigger effect. We'll call for the department, and also not leaving the Department of Labor, because they have got a role that they must play in terms of the Occupational Health and Safety Act of 1993 in making sure that there is the compliance with all guidelines and regulations of COVID-19 as been prescribed.
Thank you very much, sir.
Thank you very much.
There was NEHAU. Basically, they are all saying that they are very concerned about the way these hospitals are handling this issue. And the other issue that is happening here in the hospital, all the doctors that have their private practice inside the hospital, they are ordered to make sure that they use a telephone to consult with their patient, because they are trying to prevent the spread of COVID-19. Back to you in studio.